People with diabetes often experience issues with wound healing, especially on their feet. Here to explain is wound care specialist Larry Lodico of the Wound Care Clinic of South Jersey in Northfield. Larry, why do people with diabetes have issues with wound healing?
Robin, so we first have to make sure if a patient has diabetes that their glucose and their sugar levels are controlled in the blood. And some of the ways that we can check for these things are by testing the blood to make sure that the levels are maintained that day and over a 3-month period. And their family doctor usually are following that, but if not, when a patient comes to see us, we test for it.
So why does it make you more likely to have problems with wound healing when you have diabetes?
Well, if the sugars and the glucose levels are not maintained, the vulnerability for infection is increased, thereby a delay in the wound healing process.
And this often affects patients on their feet. Why is that?
Well, patients often get neuropathies and different problems with decreasing sensation on their feet. So thereby the first thing that happens is, unfortunately, a wound occurs or they have pain in their feet.
And sometimes they don't even feel it.
They don't even feel it.
So they could have a wound, it could get infected and go on and on before they even get any treatment.
That's right.
So the first step is to make sure that you check your feet.
Absolutely.
And
daily checks of the feet, usually once or twice a day.
Now, once a patient does have a wound, what do you do to help heal it?
Well, we first evaluate if there's an infection. We want to introduce ways to decrease bacteria levels, and then we want to make sure we provide a care plan that will expedite the healing process.
And you have many different techniques to do that.
Absolutely, there's several. First and foremost, reducing bacteria.
All right, thanks so much, Larry Lodico of the Wound Care Clinic of South Jersey in Northfield. I'm Robin Stoloff, and you're living well.